Hello, everyone. How's everyone doing? Sorry, we had some technical difficulties right now. Um, all right, as Dr. Chin introduced himself, I'm going to go ahead and introduce myself and Victoria. My name is Vanessa, for those of you that weren't here last time. I am the lead coordinator of the Dignity at Home Aging in Place Fall Prevention Program. And then we have Victoria here. Introduce yourself.
Hi, my name is Victoria. I just want to welcome everybody here. Just so you're aware, we do have a disclaimer. Hold on just a moment. Okay. So I'm not sure if everybody heard the announcement, but this meeting is being recorded, and the document or the recording will be uploaded onto our YouTube as well as our website. You may turn your face camera off at any time. If you're unable to stay for the whole session, no problem. Need to refresh your memory, no problem. Um, if you want to share this presentation with a loved one, please feel free to share our subscribe channel at Healthy Aging Association 101. And I'm going to go ahead and welcome everybody. Thank you. The purpose of Wellness Wednesdays is to educate the community and be able to promote safety and independence for all of our older adults. Our mission is to help older Americans live longer, healthier, and more independent lives by promoting increased physical activity and sound health and nutritional practices. So what we do is we exercise instruction and nutrition and fall prevention education and resources. And now I'm going to hand it off to Vanessa.
All right. So chronic conditions affecting mobility. Many chronic conditions make it harder for people to move safely. When the limbs become difficult to move, falls are more likely to happen. Most of the common resources or reasons, impacting mobility include arthritis, which is the stiffening and the swelling of the joints that make walking or bending painful, as well as spinal cord injuries, which damage the spinal cord, which can weaken the muscles and make it hard to stay balanced or stand for long periods of time. Sometimes spinal cord injuries happen first, or they could happen after a fall. Um, Lung diseases like bronchitis or emphysema, both of these conditions make people feel short of breath and quickly fatigued, which can make a person less mobile or needing to sit down more often than others. There's also osteoporosis, which is also considered as the silent condition because it can progress as we age without noticeable symptoms. This condition causes weak bones that can easily break, especially after a fall. Most of the common breaks include the wrists, hips, and spine. We also have the knee and hip problems. These limit how well someone can walk, climb stairs, step onto curbs, step over the bathtub, or stand up from a chair or toilet, basically affecting movements that we perform daily. Sorry. Yes. Right. And now we're going to have Dr. Chin and Dr. Bob do their presentation.
Great. Thank you very much. Looking forward to sharing with you. And we're going to talk about chronic conditions and fall risk. Now, chronic conditions and chronic diseases is almost the same thing, but I'm distinguishing it a little bit because sometimes we don't think about chronic conditions as a disease. So, for example, the most chronic condition in seniors today is high blood pressure. But how many of us really think of high blood pressure as a disease? Since it has no symptoms, and since it when we take medications for it, we don't feel much different. We oftentimes don't think of it as a disease, but it definitely is a condition. And a condition is something that can lead to a disease and lead to even death. And so the distinction is a rather minor one in my mind. Now, according to the CDC, a chronic disease is a non-infectious illness that lasts for 1 year or longer. So if you have something that is just for a few weeks or even a few months, that may not qualify as a chronic disease or chronic condition. It generally will last for years and probably for the rest of your life if you develop it. So let's think of a chronic condition in those terms. It is not an infectious disease. So we would not think, for example, of maybe something like tuberculosis, which sometimes can last for years, as necessarily being a chronic condition. You can be cured from that. But we would think of things like diabetes and high blood pressure and heart disease, even high cholesterol. Those are all chronic conditions. So the National Council on Aging has listed chronic conditions as being prevalent in 94.9% of people age 60 and older. Just think about that. If you're 60 years or older, the chances are 95% that you have at least one chronic condition. The chances are 78.2% that you have two or more chronic conditions if you're over the age of 60. So it is very common. In fact, it would be unusual if you were a senior and did not have to deal with a chronic condition. Both Dr. Bob and I have lamented the fact that now that we are in this age group, we certainly qualify. I think I counted 3 chronic conditions that I have. How about you, Dr. Bob? Do you have, how many do you have?
Right, probably at least 3, right? And
Yeah.
we're both on the far side of 70 though, so that's getting up there.
Okay, that's our excuse. We're 70.
Mhm.
But that just means we probably have more chronic conditions. And if you ask our wife, she probably would list Alzheimer's as one of our chronic conditions too. So
Maybe.
it might be 4. All right. But as you can see in this slide, it's very common. Okay, so let's take a look at the top 10 chronic conditions, and we'll start with number 10. The 10th most common chronic condition, according to the National Council of Aging, is indeed Alzheimer's disease. Now, they have listed the prevalence in patients 65 years and older. So 12% of people over the age of 65 have Alzheimer's disease. And Bob, do you have some idea of what that percentage is when it gets up to 70 or 80 years old?
That percentage looks a little high to me, but still, we all have known people who have memory issues. There's a more common type of problem where you are beginning to lose memory and beginning to kind of just forget where you put things and things like that. It isn't Alzheimer's, but they all affect us in ways that may cause distraction, and you can fall if you're distracted. That may make it hard for us to do 2 things at once. So for instance, for me, one time I was out walking, so I was looking at my phone, listening to a podcast, looking something else up on the phone, stepped down from the curb, walked across the street, go to get up on the street again, and trying to focus on what's in my headphones and what I'm looking at, trip, and boom, I'm on the ground in a nanosecond.
Oh boy.
From distraction. Now, I think that was more bad choice than Alzheimer's disease, but still, it just points out that maybe 20 years ago, I could have handled three things at once.
Mm.
The third thing being walking, but I learned that I can't do that anymore. So I have to change my behavior to be more safe.
Very good, very wise. I've also listed with each of these slides what can help to either reduce the condition. So under Alzheimer's, what can help is having good sleep. Let's go back to that previous slide on Alzheimer's. Good sleep definitely helps. If you don't sleep well, you're going to experience more confusion. You're going to experience less rational thinking capabilities, and even your memory can be impaired. Exercise, particularly aerobic exercise. Now, you probably all heard that mental exercises like Sudoku and crossword puzzles help. But it turns out that aerobic type exercises that increases blood flow to the brain is probably the best exercise to guard against Alzheimer's. You're never too late to start that. Even if you have the early signs of some cognitive decline, if you begin a regular exercise program, it can improve it, but definitely delay it. Diet makes a difference. So it's felt that certain things like highly processed foods probably contributes to Alzheimer's disease.
Mhm.
Okay, next slide, please. Number 9, heart failure. So heart failure is oftentimes caused by many other factors, such as blockages in the coronary arteries, but it may be also due to a valve problem in the heart where the valves are not working very well. It may be even sometimes due to high blood pressure, because with high blood pressure, your heart has a harder time pumping blood and can fail. So how do you treat heart failure? How do you prevent it? The best way is to treat coronary artery disease. For example, taking medications like cholesterol lowering medications and treating hypertension. Those are the top 2 factors that lead to heart failure, the number 9 most prevalent condition of seniors. Number 8, depression. You might not think of depression as a disease, but depression is actually a very serious comorbid condition that leads to many other diseases, including earlier death. 16% of seniors experience depression at some time in their senior years. How do you manage depression? Stress, of course, is one of the big factors that leads to depression. So figuring out how much stress you can handle. Don't put too much on your plate at one time. Decide if things are too much, ask for help from family or from other people. Diet can also be an important part of guarding against depression. One of the big causes of depression that is involved in our diet is alcohol. So alcohol is a depressive medication. It can lead to more depression. And you will see, like in many of these diagnoses, exercise is helpful. Again, exercise increases blood flow and can help people cope with depression a lot better. There are also nowadays medications that can be very useful for depression. So if you've tried everything else and you feel like you're at the point where the depression is just causing you to be poorly functional in life, talking to your doctor about medication would be important. Bob, do you have anything else you would add to that?
Well, I think that depression can can be a time when people are just thinking about themselves, and one of the best things that can help is going on a walk with a friend, where you have both exercise and you have companionship, and that's very good for even mild depressive feelings.
I'm glad you brought that up. That's a very important point. As seniors, it is much easier to be socially isolated. You just feel like you rather be by yourself, or maybe because of poor hearing or other factors, you just don't want to be around other people. But connecting with other people is very important in dealing with depression. And if you take a walk with them, like Dr. Bob says, you're also getting that exercise in there too. So great point, Bob. Okay, number 7. Chronic kidney disease occurs in 25% of seniors. And chronic kidney disease will not cause any symptoms until you're near the point of dialysis. So you have to get a blood test to know whether you have chronic kidney disease or not and how serious it is. And you have to watch very carefully the progression of chronic kidney disease if you have it. One of the most important things to watch for is the medications you take. Medications can worsen chronic kidney disease. And one of the most common medications that does that people take very frequently are what's called anti-inflammatories. That's like aspirins, Motrin, Advil, Aleve. If you take a lot of those, they can lead to chronic kidney disease. I had a patient once, Bob, in practice, who'd been my patient for maybe 20 years, a very healthy professional man. And he was due for his annual physical. He was a very healthy man in his 60s. And he did his lab test before he came in to see me. So I saw the lab test before I saw him. And the lab test showed that his kidneys were on the verge of total, complete failure, that he would need dialysis. Mm-hmm. And just a year before, his kidneys were perfectly fine. I gave him a phone call right away. I said, "What's going on, Charles, that this is happening to you? And are you having any symptoms?" He says, "No, I feel fine." But he says, "I've been taking Motrin for the last 3 months because of a arthritic problem." Mm. I said, "Stop the Motrin right away." And we repeated the blood test just to be sure the next day. And sure enough, it was still very high. But in 2 weeks, any symptoms from taking a medication like Motrin for a long time, you have to be careful about checking your blood test to know if you have chronic kidney disease.
How does chronic kidney disease contribute to falling?
Okay, we're actually going to talk about that in a moment. You're getting ahead of me, but yes, okay. Chronic kidney disease does contribute to some falling. How do you prevent it? You treat diabetes and you treat high blood pressure, 2 of the big factors that leads to chronic kidney disease. Okay, number 6, diabetes. All right, 27%, more than a quarter of seniors have diabetes. And if you include pre-diabetes, we're probably talking more like about 75% of seniors having pre-diabetes or diabetes. And obviously, you've heard of what needs to be done for diabetes. You control it. Low simple carbohydrates, low sugars. You do regular exercise. You're going to hear me say this like it was some sort of a mantra, because it is. Regular exercise and activity is vitally important, no matter what your age. You can do to the level that you can do. You don't have to go jogging and mountain climbing. Simple walking, simple exercises with the help of a chair is very helpful. And Healthy Association has a lot of these kinds of classes that seniors can get involved in. And if you're overweight, weight loss is tremendously helpful in reducing diabetes. Mm-hmm. Okay, number 5, coronary artery disease is another one of those that may not show up with any symptoms until you have your first heart attack. So how do you know if you might have coronary artery disease? You could look for the factors that lead to coronary artery disease. Number 1 being elevated cholesterol levels. So have your cholesterol levels checked. Number 2 being hypertension. If you have high blood pressure, you have to suspect that you might have coronary artery disease. And then number 3, if you're a smoker, that and coronary artery disease do not go together well. Those conditions really expose you to risk like heart attacks and strokes. Mm-hmm. What can you do about it? You can avoid saturated fats. Those fats like from animal fats, anything that comes from an animal, even cow's milk, full fat cow's milk would be a saturated fat, or trans fats. you've heard about trans fats being sometimes maybe even as dangerous as saturated fats.
Right, Crisco is the common name for a common type of trans fat,
Okay,
Crisco.
okay. Um, limit sugar and salt. Those actually can worsen coronary artery disease. Again, making sure that your sleep, your restorative functions happen when you are able to get enough sleep. And for seniors, we're talking about at least 7 to 8 hours a night. Managing stress, that can be a big contributor to coronary artery disease. Exercise, no smoking, checking your blood pressure and cholesterol.
Mhm.
Okay, number 4, arthritis. Now the numbers are increasing, right? Now we're talking about 35% of seniors having some kind of arthritis. So arthritis can be dealt with through some exercise, and not only aerobic type exercise where you're increasing your endurance, you're mobilizing your joints, which can help for arthritis, but other kinds of exercises are particularly good for arthritis, like balance exercises and like stretching exercises. We're going to talk a little bit at the end about what some of those are so that you know what they are. But think about all 3 of these exercises, aerobic, balance, and stretching in dealing with arthritis. If you are overweight, decreasing weight will help. And then you want to be able to sit with a back support on your chair, support your legs and arms, so that would be help to avoid some of the pains of arthritis. Bob, I know you've had to deal with some arthritis. What would you say about this?
Right. Well, one thing I had arthritis at the base of my thumb, so I got a thumb brace. Thumb brace goes around the thumb, also braces the wrist. It lets me do a lot of things without pain.
Okay, good. Thank you. Those would be the support things that we're talking about. Number 3. Number 3 is obesity. 42% of seniors have some level of obesity. And so obesity is defined as a body mass index of greater than 30%. So your doctor can measure your weight and tell you if you fit into that category or not. And obviously the treatments for that, good nutrition, regular exercise, and now as you know, there are some medications that are actually are well covered by insurance plans, but they definitely have been a dramatic game changer for a lot of people who are overweight. I definitely would encourage good nutrition and exercise as a regular part of your health habits first before you resort to medications. But there is help when it comes to medications as well.
Absolutely.
Okay, number But I'll tell you that if I had a choice between taking too much high blood pressure medication or not taking enough, I would choose to take too much high blood pressure medication. I would rather keep my blood pressure at a lower level. In fact, I do take a blood pressure medication. And I remember that at times when I stood up real quickly, I felt a little lightheaded. But you know what? I actually congratulated myself. I said, oh, good. That means that your blood pressure is really nice and low. It,
Well, I said too low because hypotension, low blood pressure also causes falls.
yes, that's right. So I'm not saying look for that, but I do remember feeling like, okay, I'm glad my blood pressure is nice and low, because it is so important. Okay, those are the top 10 chronic conditions that seniors have. And just think, you might have said you didn't even mention COPD. How about allergic rhinitis? How about alcoholism, drug addiction, chronic anxiety? Those are also chronic conditions. But what I've listed for you is what the National Council of Aging identify also chronic conditions. Now, let's look at this question. Next slide. Why do chronic conditions lead to increased risk for falls? And let's look at the number one reason. So the next slide. The number one reason is when you have a chronic condition, it is very likely that you're taking some kind of medication for that condition. So for example, Bob, you asked, how does chronic kidney disease lead to falls? If you have chronic kidney disease, the chances are very good that you have diabetes and or hypertension, blood pressure elevation, and you're probably taking a medication for one of those.
Yeah.
Both, for sure, medications for high blood pressure, but several medications for diabetes also. In fact, if you look through your medications, I bet more likely than not, each one of your medications may list down dizziness as a potential side effect. So medication affects is by one cause of falls in people conditions.
Wow. But, you know, is the thing I do to just stop all my meds?
Okay. He asked that as a rhetorical question because he spent a lot of his time telling patients not to stop their meds.
That's right.
So he doesn't mean that. You don't stop your medications, but you can talk to your doctor about maybe changing it if the dizziness is significant. You might be able to talk to him about the possibility of reducing the medication, and then the dizziness may go away. Or you may just take extra precautions to guard against things that might contribute even more to dizziness, which we'll talk about. So if you can control some of the other areas, maybe the medication effect won't be that important. So let's look at another reason why chronic condition leads to a fall risk.
If I can just interrupt one
Please.
thing, Rob,
Yeah.
about defining dizziness. Dizziness can be the feeling of in English, it's a word that has two meanings. One is the kind of like my head is swimming is what we used to say. You feel like you're spinning around. That's dizziness that can create fall. But another one is just feeling a little bit lightheaded. Like you're kind of, you stand up and you feel like a little woo in my head. And that's probably the most common thing you get from like blood pressure medication.
Yeah.
Because your blood pressure doesn't come up the way it should when you stand up. But either one is a big risk for falls. See, those are the two things to look out for when we talk about dizziness.
Good point. Excellent point. Okay, so the number two reason why chronic conditions can make you fall more easily is precisely because many of these conditions affect your blood pressure, just like Dr. Bob coronary artery disease can contribute to low blood pressure, and hypertension, particularly taking medications, can drop it real low. But hypertension can cause blood pressure to bounce up and down, and you can experience a low blood pressure at times. So these conditions that affect blood pressure can cause you to fall. Let's look at number three. Number three is peripheral neuropathy. That just means that you lose feeling or sensation most oftentimes in your feet, although it can be in your hands as well too. It happens in people who have diabetes. It happens in people with alcoholism. It happens in people with walking or standing to know where our position is, which helps us to be able to avoid falling.
Slowly. And peripheral neuropathy is something I experienced just this last couple of years. And when I went to a neurologist recently to look into that, this is in the area of burning and tingling in the feet. What I found was the vitamin B6 pyridoxine is now known to be a cause of that. And you can take multivitamins with extremely high supplementation of pyridoxine and vitamin B6. And that's enough in a lot of multivitamins sold over the counter to cause peripheral neuropathy. So sure enough, I had a high level from taking a Trader Joe's multivitamin, and it's already feeling better a month later after stopping that medication. So another medication side effect that can contribute to falls, because when your feet start getting numb, that's a huge fall risk.
Yeah.
So just another heads up for many of our people in healthy aging may be taking multivitamins, thinking that's a good thing.
Yeah, very good point. So just think about what we just said. We said that not enough vitamin B12 can cause peripheral neuropathy. Too much vitamin B6 can cause neuropathy.
Absolutely. Yeah.
So watch your vitamins. If you're taking too much, it can do it. But if you're deficient in something, it can lead to it. Okay, number 4. The inner ear, as you all know, governs our balance mechanism, and that inner ear can be affected by things like strokes and brain tumors. So that can lead to some dizziness.
Rob, the most common thing involving the ear, though, is the outer ear, the ear canal, which is plugged with wax, and that can cause dizziness.
Okay.
I remember a patient from residency where I cured her chronic dizziness. She'd had it for months by pulling out a wax impaction out of her ear canal.
Okay, there you go.
That's not uncommon. I've also seen that after that. Yeah.
Wow. Okay. The next one is visual changes. So things that affect your vision. And what affects your vision? Diabetes affects it, cataracts can do it, and also very common in the senior population, macular degeneration. So some of you have heard those terms and you've even been treated for those. But if your vision is not good, you can be more dizzy. You can test this out yourself. Stand on your 2 feet and close your eyes. You'll feel a little bit more dizzy. Or if that doesn't seem to show it for you, stand on 1 foot and then close your eyes. You will find it much harder to stand on 1 foot with your eyes closed. We use our eyes to help us know how to balance ourselves. So when there's visual changes, it affects our risk for falling. Next is circulation effects. So what affects our circulation? Atherosclerosis affects circulation. Diabetes affects circulation. If we have anemia, that can affect our circulation. And all of those circulation effects can also cause some dizziness. And then generalized weakness and fatigue. Obviously, almost every single one of these chronic conditions can make us just feel weaker, more tired. But some of the ones that I've listed here are definite causes for feeling weakness. And if you are weak, you're going to fall more easily. You'll trip and not catch yourself, and you won't be able to maintain your balance as well. And then last but not least, a chronic condition that causes cognitive effects. That means that affects your brain, affects the way you can think, like strokes and Alzheimer's disease, also can contribute to fall. So people with cognitive dysfunction can have that problem. Those are why we can fall when we have chronic kidney disease. Okay, now one more. Impaired walking. This is pretty common sense, right? If you're well overweight or if you have arthritis in your knees, hips, ankles, feet, you know that you don't walk as well, and that can lead to falling. Okay, now let's talk a little bit about what do you do if you have a chronic condition then. There are 3 things you can do. The number 1, specific strategies that you can do is that you should know your medications well. And I hope we've convinced you of this, because almost all medications can cause dizziness. So you want to know whether yours does or not. It might not, even though it lists dizziness as a potential side effect, you may not have it, but be aware in case you do, so that you can bring it up to your doctor. or check to see if these medication list fatigue or even low blood pressure as one of its side effects. And then, talk to your doctor about your fall risk with the particular disease that you have. If you have diabetes, or if you have chronic kidney disease, or if you have heart failure, say, doctor, what is my risk for falling? And maybe you are still at a good enough overall health condition that your risk is very minor. But sometimes if you don't ask, he might not mention it to you that, no, I think you're at very high risk for falling. You need to be very careful. So talk to him about that. And then finally, lastly, some general strategies on what you can do. We've talked about how important blood pressure, eye exam, and neuropathy and cognitive function is. Get those checked regularly, and you will recognize, many of you, that when you go to your doctor for your annual physical, he does many times check exactly these things. He'll use something to touch your feet to see if you feel it or not. He'll ask you some questions to see how your memory is, if you can remember 3 things that he tells you. He'll do a brief eye exam on you to see if your eyes are doing fine. And of course, he checks your blood pressure. So these should be fairly routine things that are checked at an annual physical. Number 2, make sure you're getting regular labs. As a senior, I would recommend that you get labs at least once a year. And if you have a chronic disease, we might be talking about 2 or 3 times a year. But check specifically for anemia, for electrolytes like potassium and sodium, for kidney and liver function. Those are things that can lead to what we've discussed: fatigue, lack of strength, poor circulation, and lead for falling. And then finally, what we've talked a lot about is how important exercise is. And exercise for endurance, for strength, and for balance. And all 3 of these are different exercises. Endurance would be resistance type exercises that strengthen your muscles. Those are very important to do. I'm sorry, endurance is more cardio exercises that strengthens your heart. So those would be anything that increases your heart rate would increase your endurance. Strength exercises are resistance exercises that strengthens your muscles and joints. And balance exercises like standing on one foot or walking down a straight line, or just doing heel and knee stretches. Those are types of balance exercises that will help you maintain your balance. Healthy Aging, in fact, has a lot of those types of programs available to do that. I think that's my last slide. Is that true? Do I have any more slides? I think it's my last one. Yep. So I'm going to turn it back to you, Veronica, if you have anything that you want to add to this.
All right, thank you, Dr. Chin. Now, tying everything that we learned from Dr. Chin and Dr. Bob's wonderful and informative presentation, what are some fall risks that you see in the picture here that are for older adults living with or without chronic conditions? And please feel free to unmute yourself and shout out anything that you see. Or type it in the chat, however, as well. Mhm.
Rugs,
Yes, rugs, thank you.
wires,
Mm-hmm.
animals,
Anybody else have anything else? Oh.
Leopards.
Yeah, so the 3 main ones that we do see here is rugs, things on the stairs, yes, open doors, lots of meds. Um, so rugs are actually very the number 1 fall risk for older adults in their homes. It's higher risk for people with neuropathy, weak lower limbs, or poor foot gait. and which leads to loss of balance. Quitter on the stairs, it's a trip hazard for those with limited mobility, joint pain, poor vision, or balance issues. The electrical cords are easily overlooked by individuals with cognitive issues or vision loss. If we can go on the next slide. Now, if anyone has any questions for Dr. Chin and Dr. Bob, please feel free to ask right now. Seems like nobody has any questions.
We appreciate people listening, and hopefully this was helpful.
Mhm,
Yes.
mhm.
Being aware of meds and dizziness, yes. All right. Well, if no one has any questions at all. It was a great presentation. Thank you, Dr. Chin and
Thank
Dr.
you.
Bob.
Thank you. We enjoy being with you. Mhm.
Yes.
Thank you.
Then if we can go on the next slide, just a little FYI, we do have our Aging in Place Dignity at Home Fall Prevention Program. We do help with fall prevention education, as well as possibly provide fall prevention accessories like grab bars, shower chairs, bath mats, and a lot of other goodies. So if you want any more information, please give us a call and we'll go ahead and start that process for you. Next, please. And then our next Wellness Wednesday will be July 30th. We will be talking about assistive devices, activities of daily living, and fall prevention. We don't have a guest speaker yet, but we will get one for you. We promise. All right. Well, thank you everyone for showing up, and we hope to see you next month. Bye.